Imagine a doctor, let's call her Dr. Evans, sitting in her office late at night. She has a patient with a very rare and confusing condition, and the symptoms just don't quite line up with any textbook case she has ever studied. In the past, she might have spent days, maybe even weeks, reading through medical journals or consulting with a handful of specialists, hoping for a breakthrough. But tonight is different. Dr. Evans turns to her computer and describes the patient's symptoms to an advanced artificial intelligence program. This isn't science fiction. This is actually happening right now, in clinics and hospitals all around the world. The AI is a new kind of partner for doctors. Within moments, the AI system scans millions of medical records, research papers, and clinical trial results from across the globe. It finds patterns that would be impossible for any single human to detect. The program identifies 3 similar cases from different continents, each with a unique treatment approach. It presents this information to Dr. Evans not as a command, but as a detailed summary of possibilities. This tool doesn't replace her expertise or her judgment. Instead, it empowers her, giving her a world of medical knowledge right at her fingertips, helping her make a more informed and faster decision for her patient. This story highlights the fundamental shift that artificial intelligence is bringing to healthcare. It's not about robots taking over medicine. It's about creating powerful tools that augment the skills of our dedicated healthcare professionals. The goal is to free up doctors from some of the more repetitive and data-heavy tasks, allowing them to focus on what they do best, applying their experience, showing empathy, and building a trusting relationship with the person they are treating. This partnership between human and machine promises to make healthcare more efficient, more accurate, and ultimately more human-centered than ever before. The potential impact of this collaboration is enormous. Think about the administrative burden that currently weighs down so many doctors and nurses. They spend countless hours on paperwork, updating electronic health records, and managing schedules. AI systems are now being developed to handle these tasks seamlessly. For instance, some AI can listen to a doctor-patient conversation, of course with consent, and automatically generate clinical notes. This simple change can give a doctor back hours in their week. Hours they can now spend listening more carefully to their patients, answering questions, and providing comfort and compassionate care. One of the most exciting frontiers for AI in medicine is in the discovery of new drugs. Traditionally, developing a new medication is an incredibly long and expensive process. It can take more than a decade and cost billions of dollars to get a single drug from the laboratory to the pharmacy. Scientists have to test thousands of different chemical compounds to find just one that might work. Artificial intelligence is dramatically changing this equation. AI algorithms can analyze vast biological databases and predict which molecules are most likely to be effective against a specific disease, saving immense amounts of time and resources. For example, in 2023, researchers used AI to develop a drug for a severe lung disease called idiopathic pulmonary fibrosis. They moved from the initial idea to the start of human clinical trials in less than 30 months, a process that would normally take over 5 years. This is a revolutionary leap forward. Similarly, in 2024, AI helped design new drugs to fight antibiotic-resistant bacteria, which is honestly one of the biggest threats to global health. By simulating how different compounds interact with proteins in the body, AI can pinpoint the most promising candidates for new life-saving medicines much faster than ever before. Beyond creating new treatments, AI is also making medical diagnosis faster and more accurate. In radiology, AI systems are now being used to analyze medical images like X-rays, kinetic scans, and mammograms. A 2024 study showed that an AI system was just as good, and in some cases better, than human radiologists at spotting signs of breast cancer in mammograms. This doesn't mean the AI replaces the radiologist. It acts as a second set of tireless eyes, flagging potential areas of concern that a busy doctor might miss, leading to earlier detection and better outcomes for patients. This technology is especially valuable in parts of the world with limited access to specialists. In many low-resource areas, AI tools can help screen for diseases like diabetic retinopathy, which can cause blindness or tuberculosis. A healthcare worker with basic training can use a camera connected to an AI system to get a quick and reliable analysis. This allows for early intervention and treatment for people who might otherwise go undiagnosed until their condition becomes severe. AI-powered diagnostic tools are democratizing healthcare, bringing expert-level analysis to communities that need it most and saving lives in the process. Every patient is unique. Your body, your genetics, your lifestyle, and your environment all play a role in your health. Because of this, a treatment that works perfectly for one person might not work at all for another. For a long time, medicine has often relied on a one-size-fits-all approach. Artificial intelligence is now helping us move toward a new era of precision medicine, where treatments are tailored specifically to the individual. AI systems can analyze massive amounts of data about a single patient, from their genetic code to their daily habits tracked on a wearable device, to predict which therapies will be most effective. In the field of cancer treatment, for instance, AI is already making a significant impact. Systems like IBM's Watson for oncology can analyze a patient's genetic information and medical history, then compare it to a vast database of clinical trials and medical literature. It then provides the oncologist with a list of personalized, evidence-based treatment options, including therapies that might not have been immediately obvious. This gives doctors powerful insights to help them design a treatment plan that offers the best possible chance of success for that specific person, moving beyond generalized protocols. AI is also making our hospitals and clinics run much more smoothly, which ultimately benefits every patient who walks through the door. Hospitals are incredibly complex systems, and managing patient flow, scheduling surgeries, and ensuring supplies are in stock can be a major challenge. In England, the National Health Service is using AI to predict demand in emergency departments. By analyzing historical data and local events, the AI can forecast when the emergency room is likely to be busiest, allowing the hospital to schedule more staff and prepare resources in advance, which successfully reduced patient wait times in 2024. This operational efficiency extends to everyday tasks that improve the patient experience. AI can help manage prescription refills, send automated appointment reminders, and even help with scheduling follow-up care. By automating these administrative processes, hospital staff are freed up to focus on more critical, hands-on patient care. This creates a less stressful environment for both staff and patients. When a hospital runs like a well-oiled machine, powered by intelligent systems, doctors and nurses can spend less time fighting with logistics and more time providing the compassionate, high-quality care that everyone deserves. As we embrace the incredible potential of artificial intelligence in medicine, we must also proceed with caution and thoughtfulness. The power of these tools comes with significant responsibilities, and there are important challenges we need to address to ensure AI benefits everyone. One of the biggest concerns is data bias. An AI system is only as good as the data it is trained on. If the data used to build an AI model comes primarily from one demographic group, the tool may not work as well for people of different races, ethnicities, or genders, potentially making health inequities worse. To build fair and equitable AI, we must be intentional about collecting and using diverse health data. Researchers and developers have a responsibility to ensure their datasets represent the full spectrum of the human population. This means committing to more inclusive clinical trials and building large, longitudinal data cohorts that reflect the real world. Without this commitment, we risk creating a two-tiered system of healthcare, where the advantages of AI are only available to a select few. The goal must be to create tools that close health gaps, not widen them. Another critical challenge is protecting patient privacy and building trust. Medical information is some of the most personal and sensitive data we have. For patients to be comfortable with AI being used in their care, they need to be confident that their information is secure. This requires robust security protocols, strong encryption, and clear rules about how data can be used. Transparency is key. Patients and doctors alike need to understand how an AI tool works and why it makes a certain recommendation. Building this trust is absolutely essential for the successful adoption of AI in healthcare. The good news is that people are actively working on these challenges. Lawmakers, medical associations, ethicists, and technology companies are coming together to create regulatory frameworks to ensure that AI tools are safe, effective, and fair. They are developing standards for testing and validating new AI systems before they are used on patients. The journey to fully integrate AI into medicine is a marathon, not a sprint. By working together to address these ethical and practical hurdles, we can harness the revolutionary power of AI to build a future where healthcare is more precise, more accessible, and more compassionate for everyone.